In a previous video, I discussed the most common question a person has after their colonoscopy. What did the doctor find? In this video, we're going to discuss other common questions. Stay tuned to the end because we're going to discuss what you can eat and when you can drink alcohol. A concern that keeps some patients from even having a colonoscopy is the risk of a perforation. That's when there's a tear all the way through the colon, which risks the colon contents leaking into the usually sterile space of the peritoneum. That leads to really severe pain, a rigid, tight abdomen, and eventually fever and an infection. Thankfully, this is quite an uncommon occurrence, and studies that would investigate how frequently it's occurring would say that it's probably less than 1 in 1,000 procedures, even when accounting for some of the more aggressive polyp removals. Polyp removal tends to be very safe because we're just removing the innermost lining of the colon, the mucosa. We're not interested in removing the muscle layers in deeper, and so therefore this does not typically perforate a colon. But what if you do wake up with some abdominal pain? Well, probably it's just gas. And what better opportunity have you had to just let one rip in public than in the middle of an endoscopy center? Because we're cool with it. And why else might you have some abdominal pain? Sometimes during the procedure, we have to put pressure on your abdomen to help navigate the scope through a twisty colon. And that can leave you feeling like you woke up with a deep tissue massage that you didn't sign up for. This pain will usually relieve with a little bit of time and maybe some Tylenol. What about bleeding after a polyp is removed? Some amount of bleeding is expected because the fact is you had a cut made in the lining of your colon. Just the same as if you went to a dermatologist and had a mole removed. When you have a polyp removed, it's going to bleed some. And just as your skin will heal just fine, your colon does so, probably even faster. And people would worry that you would get an infection where that cut was made because of what's going to be passing through a little bit later. But amazingly, this essentially never happens. The colon really takes good care of itself when it comes to being smothered in poop. So bleeding and infection after a polypectomy are unlikely, but please do let us know if you have a large bleed. Overall, this is quite uncommon. And when it does occur, you're with a perfect group of people to help you through that because GI doctors control bleeding from the colon on a regular basis. Along the lines of bleeding, what about blood thinners? If you're on one, you're going to want to know when you can safely resume it. It may be the same night, it may be in a couple of days. I can't really tell you. There's very typical guidelines depending on what the particular agent is and what you had done. And so make sure that you leave with clear advice. Ultimately, it's pretty straightforward. Now, between what happened and how to safely go about resuming your daily life, this is a lot of information to take in, especially right after you're waking up. Fact is, people are often like a goldfish. The world's new to them as they're waking up from propofol. They can swim around and ask the same question, only to forget it 30 seconds later. It's a charming thing to watch people ask the same question of me 3 times in a row while their loved ones laugh at them. We know that you're virtually going to remember nothing that happens for the first 30 minutes after you wake up, if not even for maybe an hour or two. And so we're going to give you some written summary of what we found and what you can do afterwards. If there's something really concerning, I typically delay speaking to that patient to give them more time to wake up and make sure that any family member that is accompanying them is there present with them. That way we can have a more thoughtful discussion. And again, if there's something really serious, we're going to make sure that we get you in touch with the important people for you to speak with next. If you're having more typical findings, an endoscopy nurse has very good understanding of this and they can answer virtually all of your questions. So if you felt like you missed us right after the procedure or it was just a haze, look for your written instructions, and of course, let us know if you have more questions. Now let's talk about the good stuff. When and what can you eat now that you're done? This is probably not the time for an all-you-can-eat Chinese buffet or a ribeye, so be judicious and don't choose the absolute most decadent foods, but you can eat really most anything that you want as long as you feel good. If you're feeling a little bit sick to your stomach, that's not an uncommon feeling after you wake up and it'll usually pass over the next hour. If you've got an anesthesia team, they can often give you some Zofran and make you feel that much better for it. Now, if you tend to have a sensitive stomach at baseline, perhaps you were here because you have an irritable bowel syndrome that was being investigated, then I would suggest that you take that first meal relatively easy. Also, when's the first time that you can drink? Well, you're already kind of a little liquored up with the propofol, so take it real easy in that regard. But this is also a chance for you to have a designated driver, so we'll look the other way if you imbibe at lunch. I hope this information helps you understand your colonoscopy experience better. If you have questions specific to your report, please direct them to the GI clinic that performed your procedure. Subscribe to the channel to get more information about colonoscopy and gut health. Thank you for watching and be safe.